And while getting that update from state officials, also learning how at least one local hospital system is preparing for the possibility of coronavirus. A spokesperson for HCA Virginia says that they're asking all patients and visitors starting this week to come in specific entrances so they can be properly screened, and if anyone is showing symptoms, they'll be taken care of in a way that reduces the exposure to others at the hospital. We did ask the spokesperson, are there any patients being tested in the system for coronavirus? They did not answer that question, but say that no one has tested positive for coronavirus. And of course, testing is being done for patients across Virginia and the state, saying 17 cases have been tested, 14 have come back negative, while they are still awaiting the results of 3 cases, 2 of them here in central Virginia. All those tests now being done at this state lab in Richmond. A worker prepares a sample to be tested for coronavirus at the state lab now handling all possible cases in Virginia. A change instituted this week, which state officials say gives them results in hours instead of days if they waited on the federal lab in Atlanta.
It means that we're able to institute any kind of countermeasures that we need to institute more quickly.
Officials add they have the capacity for over 100 tests at the moment and have asked for more test kits.
This team's job.
The information was part of a news conference Wednesday where state officials discussed preparations for the coronavirus should a case be confirmed.
There's a lot of anxiety, and we want to keep people calm. We want to keep things going as the way they are in Virginia and just make sure that everybody knows we're prepared.
Governor Ralph Northam says a response team has been monitoring the virus since the beginning of January and meets daily to discuss updates.
We've got that firm foundation as a Commonwealth in terms of getting the tools to the governor that he has, that he can activate depending on the situation as it evolves.
Leaders add they've also secured over $3 million to cover any response over the next 90 days for things like safety equipment and staffing costs.
Over the next 12 months, over and above that, there could be a potential for another $6.5 million that may be necessary in direct costs.
And the response team's leader adds the risk to Virginians right now is low, but encourages people to continue to monitor their website for the latest on the virus.
Don't panic, stay informed, and we'll keep information updated as it changes.
And state officials say there are simple tips that you should be taking as a precaution against the virus, such as washing your hands with soap and water, using hand sanitizer if that's not available, and not touching your face with your hands if your hands aren't clean. Also as well, avoiding people that are sick and coughing or sneezing into a tissue and then throwing that tissue out. Working for you in Richmond, Cameron Thompson, CBS 6 News.
Meanwhile, health officials